Ever wondered how African expatriates navigate the labyrinth of the German healthcare system? It can certainly seem bewildering at first, with its complex interplay of public and private facilities and the nuances of health insurance. Not to mention the challenge of finding and visiting a doctor, understanding how emergency and urgent care works, or knowing how to handle pharmacy and prescriptions. And let's not forget the importance of mental health services, which are a crucial part of holistic healthcare. It's like trying to piece together a puzzle without having seen the picture on the box. It's a task that can be daunting, and even more so for international students who are already grappling with the challenges of living in a foreign land. But fear not. This video is here to provide a comprehensive guide to the German healthcare system, breaking down each aspect into understandable segments. So whether you're an African expatriate or an international student navigating these waters, this video is for you. Stay tuned as we unravel the mystery of the German healthcare system. Germany boasts one of the world's most comprehensive healthcare systems. It's a system that has been fine-tuned over centuries, ensuring that everyone, regardless of their background or financial status, has access to quality healthcare. The German healthcare system is fundamentally divided into two sectors, public and private. The public sector, known as Gesetzliche Krankenversicherung, or GKV, caters to the majority of the population. Approximately 70% of Germans are insured under the GKV. This sector operates under the principle of solidarity, meaning everyone contributes according to their income, and everyone gets access to the same level of healthcare. Then we have the private sector, or Private Krankenversicherung, PKV. This sector provides coverage to a smaller proportion of the population, roughly about 10%. These are usually high-income earners, self-employed individuals, and civil servants. Private insurance doesn't operate on the solidarity principle. Instead, it's based on individual risk factors, and as a result, the contributions can vary significantly. Both public and private facilities offer a wide range of services from general practitioners to specialists, hospitals, and pharmacies. The key difference lies in the luxury of choice and speed of service. With private insurance, you have more freedom to choose your healthcare providers and generally experience shorter waiting times. However, it's important to note that both these sectors are regulated by the government to ensure quality and accessibility. In fact, Germany has a law that mandates health insurance for everyone living in the country. That means whether you're an employee, a student, a job seeker, or a retiree, you are required to have health insurance. The German healthcare system is like a well-oiled machine, seamlessly integrating the public and private sectors. It's a system that takes care of its people, from the cradle to the grave, ensuring that every individual has access to the healthcare they need, when they need it. Now that we have a basic understanding, let's delve into the details. One cannot discuss healthcare in Germany without mentioning health insurance. In Germany, health insurance is not just an option, it's a requirement. The system is designed to ensure that everyone, regardless of their income, has access to high-quality healthcare services. In fact, Germany takes this so seriously that it's illegal to not have health insurance. There are two main types of health insurance in Germany, public and private. Let's start with public health insurance. This is the most common type, covering almost 90% of the population. It's based on a pay-as-you-earn system, meaning the more you earn, the more you contribute. There's a certain level of solidarity in this system as it ensures that everyone gets the same level of care, regardless of their income. But what if you earn a high income or you're self-employed? This is where private health insurance comes in. It's tailored more to individual needs and often provides faster access to specialists and more comfortable hospital stays. However, it's important to remember that private insurance is typically more expensive than public insurance, and the rates can increase as you get older. So, public or private? The choice largely depends on your personal circumstances and preferences. If you value solidarity and don't mind waiting a bit longer for non-emergency treatment, public insurance might be the best fit for you. On the other hand, if you want quicker access to specialists and more personalized care, and you're willing to pay a bit more for it, private insurance could be the way to go. Regardless of which type you choose, both public and private insurance provide coverage for a wide range of healthcare services, including doctor's visits, hospital stays, and prescriptions. Plus, both types cover preventative care, which is a key aspect of the German healthcare system's focus on keeping people healthy, not just treating them when they're sick. Choosing the right insurance is a crucial step, but what happens next? With insurance in hand, the next step is finding a doctor. Now this may seem daunting at first, especially if you're new to Germany, but fear not, it's a straightforward process. Germany is well known for its high standard of healthcare and abundance of medical professionals. But how do you find the right doctor? You may start by asking friends, colleagues, or even your insurance provider for recommendations. Online platforms like Yamida or the Kassenärztliche Bundesvereinigung can also be useful for finding doctors in your area. Once you've found a doctor that suits your needs, you'll need to book an appointment. In Germany, it's common to make appointments well in advance. However, if you need to see a doctor urgently, most practices have specific hours set aside for walk-in consultations. Now let's talk about the actual visit. It's important to bring your health insurance card with you, as the doctor's office will need it for billing purposes. If you're visiting a specialist, you'll also need a referral from your general practitioner. The doctor will ask about your medical history, so it's a good idea to bring any relevant documents or records with you. If you're not comfortable speaking German, ask if there's someone who speaks English at the practice. Many doctors in Germany speak English, especially in larger cities. After-hours services are also available in Germany. If you need medical attention outside of regular office hours, you can call the nationwide medical service number, 116 117. They'll direct you to the nearest after-hours medical service. Navigating a new healthcare system can be challenging, and there may be some language barriers. However, with a little preparation and patience, you'll find that the German healthcare system is efficient, comprehensive, and accessible. Once you have a doctor, you're well on your way. But what about emergencies? We'll tackle that in our next segment. Stay tuned. Emergencies can happen anytime, anywhere. Are you prepared? In Germany, the healthcare system is designed to provide immediate and effective care in times of crisis. Emergency and urgent care services are accessible, efficient, and well coordinated. Whether you're dealing with an unexpected illness or a severe accident, understanding when and how to seek help is essential. First off, it's crucial to distinguish between urgent and emergency care. Urgent care centers handle non-life-threatening situations that require immediate attention, like minor burns, sprains, or flu-like symptoms. On the other hand, emergency departments are equipped to handle serious, potentially life-threatening conditions like heart attacks, severe injuries, or strokes. In Germany, for urgent medical situations that can't wait until your doctor's office opens, you can dial 116-117. This number connects you to the medical on-call service, available 24 hours a day, 7 days a week. However, in a life-threatening emergency, don't hesitate to dial 112, the European emergency number. This will put you through to the fire brigade and emergency medical services. Remember, this number should only be used in serious emergencies. When you reach out to these services, remember to stay calm and provide clear, concise information about the situation. Your location, the nature of the emergency, the number of people involved, and any other relevant details will be crucial in ensuring the right help arrives quickly. Once you're at the hospital, treatment begins immediately, regardless of your insurance status. In Germany, the law mandates that emergency care must be provided to everyone, irrespective of their ability to pay. If you're unsure whether your situation qualifies as an emergency, you can also contact the German Advisory Health Board. They offer a hotline that provides advice on whether to seek emergency treatment, visit an urgent care center, or wait for a regular doctor's appointment. Emergencies can be daunting, but with the right information, you can navigate them with ease. Remember, when it comes to your health, being informed is your best defense. The German healthcare system is here to support you every step of the way. Prescriptions and pharmacies are key elements of any healthcare system. In Germany, these elements are designed to ensure patients get the right medicine at the right time. Let's delve into the details. When a doctor determines that you need medication, they will issue a prescription. This is a document that instructs the pharmacist on what to provide you. In Germany, there are two types of prescriptions: private and public. The type you receive depends on your health insurance coverage. Public prescriptions are generally less expensive than private ones, owing to the different structures of public and private health insurance. Once you have your prescription, it's time to head to the pharmacy, also known as Apotheke in German. Pharmacies are found in every town and city across Germany. You'll recognize them by their large red A sign. At the pharmacy, hand over your prescription to the pharmacist. They will prepare your medication, which usually takes just a few minutes. While you wait, you can browse a wide range of health and wellness products. German pharmacies stock everything from over-the-counter medications to vitamins, skincare products, and even some homeopathic remedies. In Germany, pharmacists play a significant role in healthcare. They are highly trained professionals who can provide advice on medication usage, potential side effects, and interactions with other drugs. So if you have any questions or concerns about your medication, don't hesitate to ask the pharmacist. They are there to help you. It's important to note that pharmacies in Germany are not open 24 hours. Most operate during regular business hours, although there is always at least one pharmacy open in each area for emergencies. Lastly, remember to keep all your receipts. These are crucial for reimbursement if your health insurance covers the cost of your prescription. Navigating pharmacies and prescriptions can be tricky, but with a little knowledge, it becomes much easier. Mental health is just as important as physical health, if not more so. In a world that's rapidly acknowledging the significance of mental well-being, Germany stands at the forefront, offering robust mental health services to its residents. Just as with physical health concerns, the first point of contact for mental health issues is usually a general practitioner. They can guide you towards the right service, whether it's a specialist psychiatrist, psychotherapist, or a counseling center. And rest assured, these professionals are bound by confidentiality laws, ensuring your privacy is respected at all times. In Germany, both public and private health insurances cover mental health services, which includes counseling and psychotherapy. However, the extent of coverage may differ. Public health insurance typically covers a broad range of mental health services, while private insurance plans may offer more extensive options, such as a greater choice of therapists or shorter waiting times. It's worth noting that mental health care in Germany is not limited to one-on-one sessions with therapists. There are also various self-help groups and community mental health services. These can be a source of mutual support and understanding, offering a sense of belonging to those struggling with similar issues. Germany also takes the mental health of young people seriously. Universities and schools often have their own psychological counseling services, offering free and confidential help to students. In case of a mental health crisis, there are emergency services available around the clock. The Telefonseelsorge is a nationwide crisis hotline, available 24 hours a day, 7 days a week, and is free of charge. Navigating mental health services in a foreign land can seem daunting, but remember, it's okay to ask for help. And in Germany, help is readily available. It's a country that understands healthcare is not just about healing bodies, but also about nurturing minds. Mental health services are a vital part of the healthcare system, providing support when you need it most. So, whether you're dealing with stress, anxiety, depression, or other mental health challenges, know that you're not alone. Germany's mental health services are here to support you on your journey towards well-being. Being an international student in Germany can be both exciting and challenging. Navigating a new healthcare system is often part of that challenge. As an international student, you're required to have health insurance coverage, which can either be public or private. The public insurance scheme, known as Gesetzliche Krankenversicherung, covers a broad range of services. Private insurance, or private Krankenversicherung, often provides more comprehensive coverage, but at a higher cost. Most universities offer student health services, providing a convenient first point of contact for health-related issues. They can help guide you through the complexities of the healthcare system and direct you to the appropriate services. Remember, emergency and urgent care services are available 24 hours a day, 7 days a week. Don't hesitate to use them if needed. It's also important to understand how pharmacies and prescriptions work, and to be aware of the available mental health services. With the right information, international students can make the most of the German healthcare system. We've taken a journey through the German healthcare system, but there's always more to learn. We've explored the bedrock of the system, understanding the key differences between public and private health facilities. We've delved into the world of health insurance, unraveling the complexity of public and private policies, and how each impacts you as an expatriate. We've navigated the process of finding and visiting a doctor, and we've illuminated the protocols for emergency and urgent care situations. You've learned about the pharmacy system, how prescriptions work, and the importance of keeping your medications in check. We've also touched on mental health services, a vital part of comprehensive healthcare, and offered a special segment for international students. Understanding the German healthcare system is crucial for African expatriates in Germany. You now have the tools to navigate it with confidence. Thank you for joining us on this journey. Don't forget to subscribe to our channel for more guides like this one.